Hi, we're here at HIMSS 2017 in Orlando, Florida, and I'm talking with Terry Edwards, President and CEO of PerfectServe. Welcome, Terry.
Tracy, great to be here.
So how is value-based care changing the way care teams need to communicate?
I think when I think about value-based care, I would say probably the most important dynamics that have occurred in the market over the last 12 to 18 months are both MACRA and bundled payment. So under the MACRA rules, the way physicians will be paid by CMS will be increasingly under risk-based models. So they are aggressively doing away with fee-for-service. So, in today's environment, if I can't collaborate with you easily, I've kind of done my thing, it doesn't really matter. But now, I need to collaborate with you in order to control costs and quality because I'll be measured on those things. It will hurt me in the wallet as a doctor. And then in terms of bundled payment, there's been success with the joint replacement pilots across a number of markets. That is being drastically ramped up and expanded into other episodic procedures as well. So think of, and this puts the hospital system on the hook. So think of now, as a hospital provider, I'm responsible from the time the patient gets in the door, or even perhaps slightly before they get into the door, until many days after discharge. And I'm responsible for all the providers that are involved in that episode. I have to pay them, and they will be working cross-organizationally as well. And so in order for the economics to work, we all have to get together and work very efficiently, which means we've got to communicate and collaborate in ways that we haven't in the past.
Interesting. So PerfectServe has kind of found a solution to facilitate that communication.
Yes. That's what we started building a couple of years ago. So we've been very, very strong in managing the communication workflows around physicians. And there's a capability in our platform called Dynamic Intelligent Routing, which allows us to do very sophisticated routing algorithms based upon these situational variables that determine who should be contacted and how to do so. So we're expanding that capability into the rest of the care team. So think of nurses and ancillary providers in the acute care environment, home health, rehab, urgent care centers as well. The goal is to be able to provide the community with a common platform that works and connects them all, so they can provide better care. I mean, that's the goal.
So what are some of the current barriers to effective care team communication?
Well, I think it starts with the fact that the industry is somewhat siloed, and we've sometimes referred to it, I didn't come up with a term, but like as a cottage industry, where we've got this group of specialists over here who are doing one thing, we've got a home care agency over here, we've got a rehab facility, and everyone's independent over an episode, and I as the patient have to coordinate this myself and navigate as well. But then in each one of those organizations, as well as the acute care environment, each group has a way upon which it receives communication. So we're not like all in kind of this seamless world where information can just flow. And the way that a group receives communication depends on situational variables, such as time of day, day of week. It could be the clinical reason, the urgency. And so, remember, these are all communications related to care delivery, and so they need to be very reliable. And so those variables have to be interpreted either by the third party. So, take for example a physician practice working with 3 or 4 different hospitals, and they have a call schedule that they publish out to that hospital, and it gets on all the different floors. Well, it's pretty much inaccurate the day that it gets out there. You could have a home health agency with a whole different kind of workflow. And so the initiator has to refer to these pieces of paper, these instructions, these call schedules to connect to the right person, or there's a third party involved in the middle of it. So think of like a call center, for example, or an answering service. And they're dealing with the same manual tools, and they have to interpret where to route a communication, and they make mistakes as well. And then finally, I think cross-organizationally, the phone is still used as the primary tool, and we all know how inefficient the phone can be because oftentimes the person we need to talk to is not available at the time we initiate a communication. So those are many of the challenges and many of the barriers that exist in the environment today.
So how can communication technology enable this change to take place?
The way we've looked at it, we feel like the industry, well, there's one other thing that complicates it, and that is the HIPAA security laws. And so as we have looked at this, and what's really guiding all of our R&D investments and our longer term strategy is we feel like within that community, think of it almost like a medical neighborhood, there needs to be a tool or a platform that can connect everybody in a way that is first secure. That's just table stakes. You've got to enable HIPAA compliance amongst all these various providers. But then the second thing you have to do is you have to accommodate the workflows of the various groups. And in doing so, you make it easy for one group to connect with another. In other words, I don't need to look at a call schedule. I notice you've got a schedule here that looks like your shoot schedule for the day. I don't want to have to go through here and figure this stuff out. I want to just reach out to you and then connect to you. And if it's not you, I want your workflow to connect me to the right person. And then, as I've just described this, the other thing that it needs to do, it has to work cross-organizationally. So it can't just be the solution that I buy and deploy, amongst my people, and you buy something else and they don't talk to each other. So we've got to have something that accommodates the workflow, that is cross-organizational as well. And so with that kind of a solution in place, we can speed communications and facilitate collaboration in ways that are not occurring today.